Wow, what a great discussion. Thanks to all three of you. Really good and lots of food for thought. I think I might have written more than you, Hugh. Anyhow, I'm going to give some closing reflections, but firstly, I'm going to introduce Christina, who's going to do a Slido, and this is really important. So please don't just log off and think, oh, it's all over, because we want some feedback on the event, but also we want some inspiration for future events. So over to you, Christina.
Thank you, Breed, and thank you for a really perfect introduction, Hugh and Tara as well, because the next 5 minutes is massively important, and we really need your help in the sense of how we make the most of resources as well as the legacy from this event. So what we'd love you to do, and you might have used Slido before, is if you've got your smartphone at the ready, and if you could scan the hashtag and the QR code, or you could join via just heading to slido.com and entering the code on the bottom right hand side of this screen. This is an opportunity really to get your thoughts on how we shape the products and resources with the Innovation Collaborative that we talked about and that Donna touched on in particular. So future events and activities that we really want to make the most of for you and make sure that they are fit for purpose, and not only for that, as Hugh described, to absolutely make sure that we're making a difference to patients at the end of the day. So we have the resources available. This is going to be 5 minutes, but massively valuable to us in how we take those next resources forward. And the first question we've got, and feel free to start typing away, but maybe in as little words as possible. What is the biggest challenge you're facing right now in effectively deploying new remote monitoring tech? So we've heard on the chat this morning about things like interoperability, workforce staffing, the old chestnut around how we make sure that we're looking at data sharing as well as winning hearts and minds. So this is an opportunity for you to kind of put in about subjects that Breed, the team and the broader team can take forward to think how we can support you best with these challenges. So you can see here there's a lot of things around interoperability and skill mix coming through. Just to say as well, you can also email the collaborative after this session if you think, I didn't say that within this quick fire 2 minutes. But it's lovely to see that we're getting so many thoughts through the power of technology. So we'll just have 1 more minute on this and then we will switch to the other big question before going back to Breed for closing remarks. But please do take this opportunity because we're here to help you in terms of trying to achieve that aim, and we appreciate time is massively precious, not just today, but of course to make sure that we're using time effectively moving forward. So I think we've got 82. If we head to the magic 100, I think we'll switch. Oh no, we've already switched. Fair enough to the team. We're keeping time. So we'll go to the next one. And again, these are really key if we're looking at maybe deep dive events or smaller events for people. What topics and themes do you want to see? So how can we support you in rolling out tech-enabled home care and hearing from hopefully more Barrys and Marys and inspirational people through kind of supporting you with kind of more deep dive events, for instance. So again, inclusivity I can see on that, but it's great that we're seeing patients' experience, agreed. Maybe we should have a Barry and Mary session talking about kind of their challenges and the benefits that they've found. IDs coming up, unsurprisingly. So don't forget, we've got another 7 different events that we can tailor, hopefully, to make sure that we can support you the best we can. And in addition to that, of course, there's loads of resources already on the collaborative site. Please join if you haven't. And also on that one, we're going to put hopefully lots of more inspirational case studies with really good evidence bases and learning for you all. So this again is massively important to make sure we're getting it right for you. We're nearly up to 60 odd. If we can get to that magic 80 again, that would be wonderful. And then there is just 1 more minute of very quick feedback before we head to Breed to kind of close with some remarks about today's wonderful session. And a big thanks again from us in making this happen and joining. It's been brilliant to work with all of the speakers. It's been inspirational. We're nearly at the magic 70, but I think we might switch now. But again, please email us if you've got any thoughts in addition to this. We always love to hear from you. And you can also post in the future NHS workspace as well if you've joined. There's a good forum there that you can access at any time. So I think, Faye, if it's all right if we then switch to, we've got loads of brilliant feedback. This is a very quick survey. As Breed said, everyone hates surveys, but this is massively important. So just a quick yes, no, did the event meet your expectations? This is the point where we look between, you know, between fingers. Oh, amazing. Should we just stick with the one person that's put 100%? Brilliant stuff. Thank you. We'll have another couple of seconds on this one, and we'll keep this open for people as well. You can go back at any time and have a quick look. But that's brilliant to hear. And again, we know that we can always do things a little bit better. So even if it's just the look and feel, or whether you want more case studies, less of me wittering, please do feedback. We're really grateful for your thoughts and your input. We're heading nearly to a top 50. It's good to see that there's a high part, but we want to make sure that it's 100% in future. So if we could move on to the next question, that would be great. Thank you. Did you learn something you can apply in practice? As Hugh was saying, this is obviously the million-dollar question. If you can take something away and really work on something as part of how you move forward, even if it's connecting with somebody else in the chat, which lots of people have done, which is great to see. And we're all past the magic 60, so it would be brilliant again. Oh, the wondrous word cloud. What is the main thing you'll take away? For me, I think it's probably just it's the patient. That's why we're all here doing what we do, and amazing people from Leicestershire and the Midlands that have spoken today, how they've made an impact. So things like hearing that someone could go back and sing in a choir again was just fantastic, because that's kind of the outcome that we're really wanting to focus on. So what might you take away? Is it that you've got an important contact to follow up? You've got ideas from things like Roma's presentation around how to take some ideas forward. It's really nice to see that collaboration is in the middle. Again, sorry for the sales pitch, but please join. The resources on there are fantastic. It's the best project I've worked in the NHS, having worked for nearly 15 years in digital comms. So collaboration and patient focus, it's great to see that in the middle. And then we've got very last thing, I think we're pretty much any further comments. So I think that might be one to take away. And again, please post into the chat, contact us if you've got any broader thoughts. Very good point about how we do stuff quicker at pace. And again, I think collaboration, it's not rocket science, is key to that, and really getting that balance right between how we work digitally, but also how we work hand in glove with people, and getting that balance right between the physical and the digital. Looking forward to the next one, so are we, and we're going to make it even better. I think we'll give it a couple more minutes, and we'll probably then head over to Breed to make closing remarks. But again, a huge thank you. It's the people that bring the content alive. We're so grateful that you've attended the event and for making time when it's massively busy out there. We appreciate that. So I think, yeah, I'm pleased it is my day job. Thank you very much in that. If I would hand over now to Breed to make some closing comments, but thank you for really valuable input, and do get in touch if we can support you any further.
Great, thanks, Christina. So I'm going to keep it very brief, but I love the fact that we've had about 400 people during the course of the event. So that's really impressive, particularly with the pressure in the system. So thanks to everybody who's joined. Thanks to all our speakers and presenters, and thanks to Christina, Jane, Cheryl, Donna, all the people who've done work in the background that you may not know, but brilliant event. A couple of things that struck me. Love the fact that people say, how do we want to do stuff quicker? Because what I've observed is variations across the country where some people are managing to get that tension between doing stuff quicker but doing it safely, and we need to constantly ask ourselves whether some of the bureaucracy that we naturally seem to have in the NHS adds value, but obviously not compromise safety. So I think that's an ongoing question for ourselves. There's lots of questions on there about business cases and design and stuff, and last year we ran lots of sessions on this, and there's great resources. Everything was recorded on the Future site now, so please go on there and have a look. Really interesting to me. I'm not a feminist, but actually all our presenters from the regions were female, and actually we hear so much about women in digital. There's a real sea change happening here. So well done, ladies, at not being exclusive to our men, but that's an interesting observation as someone who's worked in technology and healthcare for many years. I think Barry's points are really valid and really, really important, and hearing them from Barry himself is so powerful. And we try to make a commitment that the patient voice comes first, whether that's real time or you know, as recordings. And colleagues have popped an interview with Lee, who was a patient in the east of England that I interviewed for half an hour, and it's a raw cut of a Zoom chat. But he mentioned well-being so many times in that conversation, and that was well-being from being at home. So thinking about, I read something yesterday about, you know, the mental health impact for people being in hospital. So really thinking about well-being, both physical and mental health. And picking up Vin's point about we've got a moral obligation to do some of this. It's interesting because recently in a conversation, I was speaking to somebody about equality and ensuring that if people couldn't access digital, they weren't negatively impacted. And actually somebody pushed back to me and said, well, hang on a minute, that means they're not getting equal care. So we need to make this available to everyone. So that was an interesting contrary view, because I was always thinking, as long as we make sure people have access to care, whether it's face-to-face or digital, that's the first key point, which it is. But now we're getting to a stage where actually some people think this is better and they want equal access to it. So that is a real sea change. Really like, I think Hugh, as you said, the shift from reactive to proactive. So really important. We started with virtual wards, but it's that upstream work around long-term condition management, annual physical health checks for patients with serious mental illness who have a 20-year life expectancy, less than others. These are really important things we need to address. And I work with the care sector. So for people for whom home is a care home, let's keep them at home. They have 24-hour care. If we can provide that medical care safely, that's really important, particularly for people with dementia who get disorientated, and coming back to that whole deconditioning point earlier. But most importantly, the thing I'd really like to close on is this is about valuing people's time, and that's patients' people's time. And we've got a lovely clip from someone who has had a long-term condition and is on warfarin as an anticoagulant and has to have lots of blood tests. He can now do all that at home. And he talks about that puts him in control of his illness rather than it controlling him. And that is about valuing time. So measuring value in time is really important for patients, but also workforce is our biggest challenge at the moment. So valuing time for our staff and ensuring we use technology to make life easier. And that comes back to some of the, well, lots of the comments about interoperability. We do need to make this streamlined and work for people. So the right information at the right place, at the right time for anybody delivering or receiving care. And I'm going to finish by saying thank you to everybody for really trying to drive this agenda forward. We will take everything that's come in the chat, all the comments on board, do a synopsis and plan the future events to really respond to what you feel is needed to support you. So big thank you and have a great rest of the day.